So what I'm going to do today is going to talk about the National Research Center called Cúram. Cúram is an Irish word. We are based in a city called Galway. Galway is on the west of Ireland, and that's where Irish is mainly spoken, which is in the west of Ireland. Cúram in Irish means care, and that's what we're all about. So it's a national medical device center, and with the ethos of care. So as Ethan and Sophia have alluded to before, Ireland is very well positioned in the as a medical device hub. 80% of the global stent production happens in Ireland. 75% of the global orthopedic knee production occurs in Ireland, and 25% of the world's injectable devices also are made in Ireland. We have a saying in Ireland, your heart, your knees, and your eyes, and your sugar is managed through Ireland. So it's the Irish eyes that speak. So the other important piece for everybody to know is that 14 of the top 15 global medical technology companies are based in Ireland. Some of them are headquartered in Ireland. 25% of those have global business service mandate, and 60% are engaged in research and development activities. So it's not only manufacturing, but also a lot of RDI activities happen in Ireland. So Ireland's population is only 4.5 million. So it does play a fairly significant role per capita in the context of the sector. Plays a very important role in the context of the economy that we comprise of. Our global exports are second in Europe, but per capita we are the highest. As you can see from the chart which you see, we are the highest exports per capita in the whole of Europe. So in other words, from the government point of view, we are a very significant sector of the market, which also brings contributes a lot to the economy of Ireland. If you look at the global medical tech hubs, Ireland is very strong. The other hubs would be Denmark, Germany, Switzerland. India is upcoming, Singapore, Minneapolis, Boston, and San Francisco. Those would be considered as the global medtech hubs, and we are placed very well in that context. In the sector has grown in the last 25 to 30 years, and the reason for the growth is mainly a very strategic way the government has created an infrastructure. Universities have scaled up. I myself started the biomedical engineering program in Ireland, the first one in Ireland. So all universities now have biomedical engineering programs which cater to the medtech industry. The research centers such as Cúram has been established. EU funding has come in through large numbers in the last 25 years. Almost every hospital have a clinical research facility, and these clinical research facilities are work in congruence with the universities. There's a significant amount of startup and industry cluster investors which have come into stream for the last 20 years. I moved to Ireland 22 years ago, and there were only 3 startups, and now they have multiplied at least 30 times to what the number was before. So a huge amount of investment has come in, and that's a result of the research that's present, because earlier there was only manufacturing. Now a lot of cluster activities have occurred over the years. BioInnovate, or which is based on the biodesign program from Stanford, was established is a very well established program in Ireland, and one of the most successful biodesign programs across the globe. PPI, which is the Public Patient Initiative, also has been established, and all the hospitals and in the universities are heavily engaged with the patient population. ARCHIV, I'm not going to talk about, but My colleague David Townley will talk about ARCA, which is a new initiative which has been funded. So if you look at, I told you the pieces of the puzzle, but if you were to look at the whole system itself, the country itself is very well placed in terms of discovery, ideation, translation, commercialization, and ultimately patient impact. Ultimately, what we want to see is patient impact. All these elements play a very significant role in that piece of it. Research centers typically span the whole gamut, but the focused piece for ideation comes from Bioinnovate. The clinical research facility really work on translation piece of it, and the commercialization space, ARCA, mainly in commercialization and translation piece. Industry spin out startups and investors also play a role in translation space itself. So, if you look at the whole system, it's a very unique system in a small country of Ireland, where these systems are working together. They're not discrete in any way. Some have more emphasis than the other in the different aspects of the medtech ecosystem. This is Ireland, the map. If you see Ireland on a sunny day, it's a very sunny day outside. That's what you see. It's a beautiful green country. Galway is on the west, as you can see, and on the Dublin, our capital, is on the east. The distance between Dublin and Galway is only 2.5 hours. Taiwan is very similar, I think, in some ways. So there is a similarity in the greenness that you see in Taiwan is also seen as you see in Ireland. Then Cúram, the center, has many hubs in all the universities. So we are centrally placed we are hosted in Galway, but other universities have also distinctive hubs that are present, which also are related to Cúram. The MedTech Valley or MedTech activity is mainly on the west of Ireland, Galway, Limerick, and some in Athlone area itself. That's where most of the MedTech industry is based. So if you were to visit, you have to stop in Galway to see not only this beautiful city, but also in the MedTech point of view, it's a critical city in the system. So Cúram's mission is to be a global leader in the creation and translation of clinic-ready and patient-focused medical devices. We are based in a university. We are hosted in a university. So our focus is also in education. So we want to develop the next generation of industry-relevant and publicly engaged researchers, become an anchor for industry applicable research, and to enable, empower, and embed a culture of equality, diversity, and inclusion. And we take all of these elements very seriously because we do live in a global environment, and we do welcome everybody in the center from whichever background they are from. So just a brief on how this evolution of the center began. Things did not happen. Things happened for a reason, and there was a natural growth of the center itself. So in 2003 to 2011, there were smaller centers that were funded, and they were all contributing to the medical device space in terms of biomaterials, regenerative medicine, drug delivery network, and alimentary glycosciences piece, or more biosciences pieces. So those foundations were raised in 2003 and 2011. 2015, Cúram was funded as a national center. We received 26.8 million from the major funding agency called the Research Ireland. All these clusters that I alluded to before were merged, and 7 institutions were partaking in that context. To 2021 to 2026, Cúram 2, the next phase, was also funded. The focus then was to translate prototypes. The first phase is about creating the critical mass and creating a significant amount of activity as the center goes. The next phase was, can we create prototypes, or can we create clinically viable prototypes in that space? So that's what happened. 10 partner institutes were also involved. We've just announced that we've been continued from 2026-2034 with a new branding, where we are we're moving to the next step by engaging the patient in the healthy aging conversation. So it's a very different center that we're going to see from 2026-2034. And that announcement has been made, and we've been funded for 50 million. So we will be branded as a national center, a national asset. So when you come to Ireland to Medtech, this would be one stop that you would have to make, which is the Medical Device Center. Ours is a global family, as I alluded to. So far, we've had 1,152 team members, which have partaken within. Has been a part of CÚRAM, such as Ethan on screen. He's also been a part of CÚRAM. We've had 124 academic leads, which would be professors and other researchers. Senior researchers would be a part of that equation. We have had 18 clinicians who've led clinical trials, and many more who would have supported clinicals. But these are clinicians who would be key opinion leaders in the field, who would have taken the first device to the clinic. We have partnered with 22 MNCs, multinational corporations, and 26 small to medium enterprises. And as you can see on the screen, these are all fairly big companies. The top 5 medical device companies we have worked with them. You can see Boston Scientific, Stryker, Takeda, and others. Cook Medical, they're all fairly large and AbbVie, very large companies which have really invested within CÚRAM. Our research program is based on 3 clinical pillars, and these 3 clinical pillars are based on the expertise we have in terms of science and engineering, the clinicians or the key opinion leaders we have, and the industry we have. So it's a tripartite relationship that makes us define what the clinical pillars should be. So if we have strength in the industry, we have strength as a clinician, and we have strength in the expertise that we have at the fundamental level, then that's good. Then that's a good project for us, or that's a good pillar for us. Undercutting those research programs is entrepreneurship training, because we do work with PhDs and researchers. We do offer that training. We offer that training with our colleagues within the system, such as BioInnovate and other units. We have a very strong presence in public engagement, because we do realize that the public needs to be aware of where the taxpayer money is going, and we also offer translational support to the projects that come in. Our expertise is mainly in the area of bio. We cannot be everything in the medical device space, but it's mainly in microelectronics, robotics, biomaterials, drug delivery, tissue engineering, and regenerative medicine, and also device design. In terms of translation support, every project gets support from a regulatory space. We identify what regulatory pathway they could potentially take. We do support the projects in terms of biostatistics and understanding, supporting what is the best statistical methodology that can be used in developing an appropriate clinical design, or even a preclinical study. We would create that support structure, and also determining the likely value for money. In other words, a business case, if there is in that particular project. All our projects have we have taken a strategic view in terms of developing strategic partnerships. Every project that we have would be mapped out in terms of its translational path. To give an example, project which I work very closely is in cardiac and development of a cardiac gel, which will reduce scar formation. So for that purpose, the center has helped in mapping out the regulatory path for that technology, as well as creating funding through European. This will be a class 3 device, and also because the longevity of translation is much longer in this case, we would have created research funding from the European Union to take it to GMP production. So that's just an example of that. But we would monitor every project, and we would try and raise money if it makes sense up to the GMP production stage. We do publish well. I mean, we are based in academia, so we do publish really well in the top journals of the field. One of the metrics that is key is called the FWCI, which is a Field Weighted Citation Index, which means that the journal, an average FWCI would be 1, which should be, we are 1.83. In other words, we are much more heavily cited than most other centers in the field. So we pull our weight in among the top academic centers across the globe. We engage with the EU, European Union, quite well as well. We have brought in significant amount of money from the European Union by coordinating 28 projects, EU projects. We have worked or partnered across EU with 140 EU projects. We've got 21 European Research Council awards, which are the most prestigious awards that one can get in Europe. 92 million of European funding has come to our own investigators through Europe alone, which is significantly more than what the state has given us. So that's a really good story for us to tell. The other very important piece, which is probably the most important figure, is the 12.1 million, which goes to the Irish industry. So when we write our European grants, we also engage with the Irish industry partner, and we can raise money which goes directly to the Irish partner. So if a Taiwanese company comes here, we can write a European grant with them, and we can support them directly with money from Europe if they are based in Ireland. We are also very good in creating PhD networks, doctoral training networks. We have coordinated 18 networks across Europe. These networks are very difficult to get. They're called ITN, or Innovative Training Networks. The chance of success in Europe is 5%, but we have done 18 networks. So our success rate is very good in the context of European Union itself. And also we've partnered in 5 additional networks. The important part of networks is also when we work with these networks, our researchers in that are seconded to the industry partner itself at no cost to the industry. So you get valuable expertise within your company at no cost to you. So we asked a question to ourselves a couple of years ago, is if the government invests in us, what is return? What is the value for money if it's investing in the research center? So the government gave us 64.8 million from 2015 to 2026. We can, with our calculations, which was done externally by Mazars, which is like a KPMG, like an organization which is external in nature, their calculations showed that every euro invested by the government realized 12.66 euro in the economic return in 2026. And that calculation was based on the European Union money that we have raised, the total jobs that were supported externally outside the center, what has the industry contributed to that, and what other leverage grants that we have, and the value of the jobs that we created. We, as a center output goes, the job value of individuals which come out is very, very high because they create technology itself. So in many ways, the 12.66 value is an understated value in many ways, because we don't really know the full extent of what value that individual has done in the destination they have been in. So it's a very good figure. We are proud to say that every euro gives us 12.66. It's a very good investment in research. We've collaborated, as I gave you examples, we work with industry significantly. We have a few metrics that we look at in working with industry. One is it has to be a medical device. We are a medical device center, so we have to work on a medical device. It has to be a design or research need. We are not a contract research organizations. We are a medical device center. We need to have an investigator in that space. There needs to be a cash contribution for 2 years, and we have a minimum value of that cash contribution that the industry should provide. We also look at the value proposition of the project, and we also look for in-kind support. And ultimately, we want to create jobs for the Irish economy. There are some good things to have, like, potentially there are publications, it's newsworthy, we like working with world leaders in the field, or other PhDs and postdocs that are going to support. Those are good to have, but the critical ones are the ones which I talked about before. One of the hallmark of our success is the repeat business that we get in engagement. And I'm not going to talk through each of those slides, each of these figures here, but each of the company, the yellow bar which talks about the original investment of the company, and over a period of time, you can see that all of these companies have significantly increased the value and the longevity of investment over the years. I'll give you only one example of Cerenovus, which is a J&J company. Initially invested only 110K, and today they've invested 13 times as much to 1.4 million. So it's very significant that they all keep on coming back, which also tells us the value of the engagement that these companies are getting. So I've given you many examples, but the question becomes is, how do we work with Taiwan? We are about the same size of Taiwan. There are a lot of ways you can look at entry into the European market through Ireland. Ireland is a good base for entry because we are one of the top medical device exporters. It makes sense to enter Europe through Ireland, and that can be done as an industry which is coming in. We can look at co-funding opportunities. We can match up to 50% of that funding. You can look at IP licensing. We have a huge portfolio of IP in Ireland. Some of it is contained with Cúram, and also my colleague David and the BioInnovate fellows also have a lot of IPs that could be licensed by investors, and we can look at upfront milestones and royalty systems within our systems, and we can look at a dual branding associated with entry into Ireland and entry into Taiwan likewise. So it's so there becomes a good flow across, and it's a equal partnership that can enable where a company can be based in Ireland, company based in Taiwan. You have two markets, double market access across the space. Ultimately, our goal is to create jobs in Ireland, and also we are rich in technology, and we realize that the Taiwanese system is also very rich in technologies. We can make a much better viable market sell across the two countries. So here we are. This is my last slide for today. What I want to say, if I want to leave a message with you, the message is, if you want to be a global players, the top 5 of the medical device companies are based in Ireland. If you want to be in the top 5, you need to have a base in Ireland, and we can help you with creation of the base through the center, and there are other agencies also that will also help you. There's a huge infrastructure awaiting for you to tap into. Thank you very much.